Hello and welcome to part one of sedative herbs, where we'll have a look at the hot excited tissue states that sedative herbs help, and look at some of the herbs in the Materia Medica, particularly the sour ones. So we use sedative herbs wherever there is excess heat. And it's worth noting that sedative herbs are not necessarily nervine sedatives. For treating the hot excited tissue state, this is characterized often by inflammation, with the classic symptoms of heat, swelling, tenderness and redness. The tissues are irritable in themselves. They need little stimulation to be roused. If you contrast this with the constriction, where the tissues are overstimulated by nerves, and obviously there's maybe a bit of crossover there, but that gives you a general picture. The pulse may be rapid, beating to the surface, superficial pulse. The tongue may be elongated, pointed and red. I don't know how red my tongue is. The hot excited tissue state can sometimes be secondary. It can arise as a secondary effect from damp congestion. If we try to correlate it to conventional pathology, obviously febrile illness would fit in to the hot excited tissue state, as would the excitation that might be present in autoimmune disorders like lupus and RA. And then allergic reactions are also a hot excited tissue condition, like eczema and hay fever or allergic rhinitis. Sedative herbs tend to taste sour and fruity, containing fruit acids or flavonoids, or they may contain bitter diterpenes, phenolic acids and iridoid glycosides. So, looking at the sour tasting sedatives first, these are common in the Rosaceae family, for example rose and hawthorn, crataegus, but also in Melissa is a sour tasting sedative, Schisandra to some extent is sedative, and Passiflora incarnata or passion flower. So looking at rose, it has cooling, sweet, drying and sour qualities, especially the hips. The fruit are sour, and we use the fruit, the hips or the flowers. Principal actions: sedative on the whole body, tonic to the nerves. The rose flowers in particular are used for agitation, anxiety, especially at the menopause. They're astringent and anti-inflammatory, so they're useful in gastritis, mucus colitis. Rose hips are used for colds and sore throats and as a prophylactic against respiratory infection. More commonly we use dog rose or rose hips from the hedgerows. Rose contains volatile oil, obviously, geraniol, nerol, tannins, and there's fruit acids in the hips, quite rich in vitamin C. Crataegus or hawthorn is another sour Rosaceae, not as sour as the rose hips. It's a tonic astringent, has a cooling effect, it's sour and sweet, and we use the berries, the leaves or the flowers. And you can kind of use monogyna and levigata under different other names. You can kind of use them interchangeably. Principal actions: crataegus is a cardiac, sedative and trophorestorative, hypotensive, it lowers blood pressure, and a peripheral vasodilator. So the four principal effects are that it decreases peripheral circulatory resistance, it dilates the coronary arteries, which increases the nutrition of the myocardial tissue, and then that allows an increase in the force and efficiency of myocardial contractions, so you get more for your money with each heartbeat. Crataegus also has the effect of decreasing the heart rate. So these actions all work together to give quite a tonic effect on the heart. So it's supportive in heart failure, especially if that's due to age or mitral stenosis, narrowing of the mitral valve, in angina pectoris, and where there's arrhythmia of the heart. It's antisclerotic, working against hardening of the arteries, and protective to the vessels. So application in arteriosclerosis and in Berger's disease, which is a condition where there's inflammation, itis, of the blood vessels, Angie, which causes obliteration of the vessel due to the inflammation causes obliteration, but also the inflammation can arise from obliteration from a thrombus or clot. So that's unpicking the fancy name. So flavonoids in Crataegus, especially oligomeric procyanidins, and you'll see a lot of research on these compounds. It's hypotensive, so there isn't contraindications as such, but be cautious if somebody's already got low blood pressure, and be cautious if somebody's already taking conventional medication to lower blood pressure. So for example, beta blockers, digitalis. Melissa is another sour sedative, sweet and cooling as well. We use the whole aerial parts, preferably just before flowering, which I always think is a pity because you never get to see them flowering, do you? But there you go. Principal actions: a sedative but uplifting nervine. It's good for nervous agitation, restlessness, irritability, headaches, palpitations, insomnia. It has a mild antithyroid action, mildly inhibiting thyroid stimulating hormone, and it inhibits the conversion of T4 to T3, T3 being the active form of thyroid hormone. It's also diaphoretic, febrifuge and antiviral, so it's useful for feverish viral infections, but also for hot flushes and night sweats. It's carminative and spasmolytic, so useful for indigestion, flatulence and colic. Externally, a cream can be used to treat herpes simplex, cold sores. Constituents also rich in volatile oils, including neral and geraniol, which from the endings are obviously aldehydes. Flavonoids again, and some tannins. So be cautious if somebody's got an underactive thyroid. Fourth, isn't it? I've lost count. Schisandra, very sour, but also sweet, bitter, pungent, astringent and salty. Many tastes involved in Schisandra. Here's a photograph of a bush growing in Andrew Stableford's garden. Usually we use the fruit. Principal actions are as a sedative, anti-inflammatory, so it's hepatoprotective and cholagogue. It brings forth bile, indicated in acute and chronic liver disease, where there's poor liver function and poor excretion. It's also antitussive, so it can be used in chronic cough and asthma. It's a mild adaptogen and a restorative to the nerves, so it helps you cope with stress, and it improves physical and mental performance. It calms the mind but improves mental focus. Constituents. The most important constituent is this schizandrin, lignan. You can see these phenol groups all linked together. These CH3s are methyl groups, and some of them may be called Me, so MEO is a methoxy group. So that might make it taste a bit sweet, I don't know. Anyway, be cautious with Schizandra when it's the early stages of inflammation, so in coughs or rashes. Be cautious where there's an excess heat pattern, and don't use it in pregnancy except in assistance in childbirth. Passiflora is cool and dry, as well as being sour. We use the herb rather than the fruit, but the fruit will have some of the same principles. It's sedative, hypnotic, and analgesic. So this is a herb that does have a definite sedative effect on the nerves. Useful in anxiety, agitation, insomnia, for helping with drug addiction and fidgeting. Systemically, it's hypertensive, a vasodilator, useful in high blood pressure and tachycardia if that's due to sympathetic excess, which would be part of a hot excited picture. Antispasmodic for gut problems and also respiratory spasms, so it could be of use in asthma. Constituents: it contains Harman alkaloids and other useful components. No contraindications as such. The Harman alkaloids are monoamine oxidase inhibitors in vitro, but the low content in the whole plant extracts makes that not a problem. Note the lower dose than some herbs. Absolute maximum I would say is 40 ml a week. Anything beyond that, then you're going to get a fairly zonked out patient. So that concludes the sour remedies. I'll have a go with the bitter remedies that are sedative in another video. Thank you.